All right, so welcome everybody. My name is Dr. Kynetta McFarlane. I'm the owner of Transformative Health, where I provide trauma-informed and affirming care to Ohioans. I'm also the Systems of Care Equity Inclusion Coordinator at CASES, Center of Innovative Practices. So today I'm going to be talking to you all about transgender health, but not really just transgender health. We're going to be talking about the health of queer kids, but I do want to highlight specifically transgender health and non-binary health, because when we look at those two communities out of the queer umbrella, those are the communities that face the highest level of stress and distress. So the first thing I want to go about is, I just told you that I provide trauma-informed and affirming care. What does that mean? So most people know what the trauma-informed part means. So let's talk a little bit today more about what the affirming part means. So when I say that I'm an affirming therapist, that means that I recognize that there is human diversity, and that accepting that homosexuality is just a part of the natural variation in terms of human diversity. If I was talking about being affirming in terms of when I work with autistic clients, I would be talking about recognizing the human diversity that exists in terms of how our brain works, in terms of neurodiversity. So there's lots of different ways to be affirming. This way, I'm talking specifically about the queer community. And when I'm saying queer, I'm talking about kids and families who identify as gay, lesbian, homosexual, bisexual, pansexual, transgender. So anybody who fits under the category of a sexual or a gender minority. So to also be affirming, I want to be actively working on reducing my personal bias and my prejudice. So I want to be working on understanding of the queer communities. And I also want to be looking at any kind of like heterosexist bias in terms of like assumptions that I have about a person and their life and lifestyle. I want to be looking at that. I also want to be recognizing that queerness is normal and that it should be affirmed, so that there's nothing wrong in terms of that difference, in terms of you being a sexual or a gender minority. And then I also want to pay attention to intersectional issues. And so when I talk about intersectionality, that's looking at how you are a member of different groups and how those groups all intersect and how that makes your experience different. So I'm a queer individual, and I'm a Black queer individual, and I'm a Black queer female individual. The way I look, I am cisgender in terms of what I was assigned at birth matches up to how I identify myself, and my gender expression, the way in terms that I carry myself, my mannerisms, they're all very feminine. So when I walk around the world, even if I have on rainbows, people may not at all like see my queerness. However, if I was a Black female and I was masculine presenting, I would likely have a very different life experience, because it would be very obvious to others that I was queer. So that is in terms of looking at intersectionality. How is that person's life different based on all of these overlapping different areas in their life? So why is it important to be affirming? We know that there's high rates of suicidality among the queer community. Most queer youth report high rates of depressed mood or anxiety. Most live in non-affirming homes, and many want therapy but face some type of barrier. We've known that the whole world has dealt with poor mental health during COVID, and we have seen this in the queer youth community. And we also know that affirming someone's gender leads to lower rates of suicide attempts. But how do we know all this information? Well, we know all this information through the Trevor Project. The Trevor Project is the world's largest suicide prevention and crisis intervention organization for queer or questioning young people. So we recognize that suicide is still a great public health crisis and is the second leading cause of death among young people, and this disproportionately impacts queer youth. So this is the third year that they've released this information, and it's the largest survey ever conducted on queer youth. And it ranges from the youth that they asked these questions to. They asked 35,000 youth that span the ages of 13 to 24 across the United States. This year was also the most diverse survey that they've done, with 45% of the youth being of color and 38% of the survey having 30% of the youth are either transgender or non-binary. So we're going to go through these different areas to see like some of the big findings of the survey. So the first one we're going to look at is suicide and mental health. They found that 42% of the youth had seriously considered attempting suicide in the past 12 months. Now, when they looked at these numbers, the lowest numbers were found among white and Asian Pacific youth of 12%, but significantly higher numbers were found among Black youth, multiracial youth, and the highest were among Indigenous youth. 72% of the youth reported symptoms of generalized anxiety disorder. And when we looked at transgender and non-binary youth, 3 out of 4 reported those symptoms. When we looked for the symptoms of major depressive disorder, 62% of the queer youth reported having those symptoms, and more than 2 out of 3 transgender or non-binary youth also had those symptoms. So in terms of finding support, almost half of these youth wanted mental health counseling but didn't receive it. However, 36% did. Now, when we look down at the breakdown of race, it looked like it was pretty equitable in terms of who wanted services and in terms of who received it. More than 80% of the youth of all races and ethnicities said it was important that crisis lines should have a focus specifically on queer youth should they need it. And so one of the things that they said that was important to them is having like 24-hour availability, having text availability, having that specific focus on their youth, having like web chat features, and also having some type of a messaging system. So when they looked at COVID-19, 70% of the youth stated that their mental health was poor during most of the time or always during COVID. Most said that COVID negatively impacted their mental health in more than like half of the categories. So when they looked at it, it impacted their health. When they pulled it out among race, age, and gender in all categories, they found that COVID very much impacted mental health. Nearly half of the youth said that it impacted their ability to actually express their sexual orientation. And then 60% of the transgender and non-binary youth said that it impacted their ability to express their gender identity. 40% of the youth talked about losing a job, and 80% said that it made their living situation more stressful. In terms of looking at support in terms of for transgender youth and non-binary youth. So that NB that you see up there, that is the abbreviation for non-binary youth. NB is the abbreviation for non-Black. So if you looked at this is NB. And so this is the abbreviation for non-binary youth, or youth who don't identify as male or female, or who may fluctuate in terms of where they see themselves on the gender spectrum. So in terms of when we look at support for transgender and non-binary youth, affirming them leads to lower rates of suicide. So what does affirming them mean? That means things like respecting their pronouns. So when people talk about how a simple thing is just like respecting pronouns as suicide prevention, this is why they're saying it. Other ways that we can affirm these youth is by allowing them to change their designation on legal documents. Another finding of this survey was that almost half don't have their pronouns respected in their home. So again, this is part of the reason why like the message is said loud and clear, that just respecting a person and using the pronouns that they would want you to use for them lowers their risk of suicide. So food insecurity, 30% of the youth reported experiencing food insecurity in the past month, including at least half of the indigenous youth. 27% of the youth said that they worried that food in their home would run out in the last month before they or their family had the money to buy more. 19% of the youth said that in the last month they were hungry but didn't eat enough food, or their family didn't have enough food to eat. And one of the things that they found overall was that there are significantly higher rates of suicidality among youth that experience food insecurity. So conversion therapy is the abusive type of therapy that tries to change these children from queer to non-queer, and has been condemned by most of the APA, most of the different branches of mental health. And so youth who were subjected to this type of therapy reported more than twice the rate of attempting suicide in the past year compared to those who were not. Transgender and non-binary youth reported being subjected to conversion therapy at twice the rate of their cisgender peers. So cisgender is somebody like me, where my sex assigned at birth matches up with how I identify myself. And LGBTQ youth also reported being subjected to conversion therapy, being an average age of 15 years old, and 83% of the youth reported that it happened prior to them becoming the age of 18. In terms of discrimination, 75% of the youth reported that they had experienced discrimination based off of their sexual orientation or gender identity at least once. More than half of the youth reported that they had experienced discrimination within the last year. Half of the youth of color reported discrimination based off of their race and ethnicity within the last year. And LGBTQ youth who had attempted suicide in the past year, when we looked at broken it down, there were significantly higher rates of attempted suicide among those who had faced more incidents of discrimination. So affirming spaces. So we talked about being an affirming therapist. So I try to create an affirming space, a space where somebody feels comfortable in terms of being themselves. So only 1 in 3 of these youth found their home to be a queer affirming space. And so where did they find these spaces though for themselves? Almost 70% found them online, 50% found them in school, and only 34% of the youth said that their home was an affirming space. And the numbers were similar among transgender and non-binary youth. They were just lower in generally every area, except they found more acceptance online than the non-transgender or non-binary youth. Youth who had spaces to places that actually affirmed them had lower rates of suicide and attempted suicide than those who didn't. And they also identified that social media had both a positive and a negative impact on how they felt. So while 80% said celebrities and brands could impact how they felt, they also identified that social media could also be negative and can negatively influence their mood. So overall, hopefully all this information says to us that part of what we need to do for these kids is to help them in terms of making our space be one of those affirming environments that they really need, since only like a third of the sample really could find those spaces in those homes. And so when they say though, when they look at it, 80% of the kids did have someone that they found affirming. And so I am very happy to be one of those people, and I hope that you are too. But how are some like ways that we can do this? First thing is checking our bias and being open to the fact that we all have biases. And if you're not open about that, then you can't really do much about it. So being able to have your bias checked and being able to be open to new information. Other things we can do, making sure that we give name, pronoun, and gender preferences, both verbally and on forms, and update them if they change for the individual. Educate others around us about somebody's names or pronouns. Making sure that we have like various types of people in terms of like our books that we have around us, or in our signs and pictures that we have up, or what symbols do we have shown around to show that we're an affirming space. The other thing is practice. Pronoun use, you need to practice how to do pronouns. I suck at pronouns. I look at a body and I still make quick calls, even though I know to ask. So I need to practice, but then when I make a mistake, I apologize and I keep it going. I don't say, I am so sorry that I messed up at your pronouns. I know that I'm so bad at it, because then it just highlights to everybody that I've messed up. And now it's become more about me apologizing than you. So in terms of all of this, I hope that we can all work to create a more affirming environment for these kids, because the research shows that they really need it. Thank you.